can let them down. Okay, I want you to look to the left, to the right, back to center, and down. Sharp. Dull. Sharp. I'm gonna hold it like this, and then we're gonna fold. Okay. Okay, so now I'm going to be turning your head the other way slowly. Might feel a bit uncomfortable again. I'll just hold this position for a little while. And now we're going to sit up slowly. Again, I'm going to hold your head up, okay? Okay. I've been using Native's plastic-free deodorant for the past year, and I am still so in love with it. I can count on it to give me all-day odor protection, even if I'm outside, getting sweaty, working away in the garden. I've tried many aluminum and paraben-free deodorants on the market. I've even tried to make my own, and nothing ever comes close to Native's formula. It's made with familiar and simple ingredients, including coconut oil and shea butter. The formula feels really good on my skin. It is never sticky and it dries very quickly. The scents are so delicious and satisfying. This is my favorite, the pina colada scent. You all know that I'm crazy for coconuts, and this is my favorite cocktail ever. So this scent, along with the ginger mule, citrus spritz, and rosé, are part of the limited edition cocktail-inspired summer collection, and it's only available until the end of summer, so grab one before it's gone. It's so sweet. It honestly feels like you're in a tropical paradise with a pina colada in your hand. This is my second favorite, the lavender rose. It's such a relaxing floral scent. And then we have the charcoal. This one smells so fresh. And lastly, I am so happy that Native is continuing to embrace plastic-free packaging. So it's made with 90% post-consumer paper, and Native is committed to sourcing from responsibly managed forests. I really love Native's new plastic-free packaging. It's quite different from their first version. I find this one's easier to apply because of its oval shape. The formula between the 100% plastic-free and the plastic deodorants are exactly the same. The only difference is that the packaging is much more sustainable. 3 of these lovely deodorants are normally $39, but if you use my link below and my code, all caps, Semide Coco, you can save 33% and only pay $26. With my code Semide Coco, you can also get 20% off any Native toothpaste or body wash. I really hope you'll try Native's plastic-free deodorant. Let me know what you think in the comments below, and I'll see you in the video. Hi, welcome back to our office. What brings you in today?
So, about a week ago, I started getting really bad vertigo. Really dizzy spells that come on maybe like 2-3 times a day. I find that it happens more often when I move my head suddenly or if I get up too quick or whatnot. So, it's just been really uncomfortable. So, I really just wanted to get some help and treatment for that.
Yeah, for sure. I'm so glad that you came in. And so if I'm hearing correctly, you're experiencing vertigo for the past week, 2 to 3 times a day, and it happens when you're moving your head suddenly. Okay, I'm going to ask you a few more questions about this. Do you know if there's any specific trigger that might have brought on this vertigo?
I don't think so. I feel like it happens at random times, that it's not due to anything specifically.
Like, is there anything happened a week ago? Like, were you in an accident? Were you injured? Any kind of trauma to the head at all?
No, there's nothing.
Okay. Have you been sick? Have you had any infections?
No.
Okay. Any fevers? Anyone around you who was sick?
No, I live alone.
Okay. Have you ever experienced this before?
No, that's the weirdest thing. It just came out of nowhere.
I see. That must have been scary for you. Are there any symptoms that go along with the vertigo? Like, do you feel any nausea, any vomiting, anything like that?
The most prominent symptom is definitely the dizziness that kind of like takes me over for 20 seconds during a dizzy spell, and that's all I can really feel. Sometimes if I hold my head, it gets better. Aside from that, I have felt nausea. It's not every single time, but sometimes. I've never gotten to the point where I've had to throw up.
Okay, so occasionally nausea with the dizziness. Yeah. So you specifically said dizziness, but you also mentioned vertigo, right? Do you feel that the room is actually spinning around you? Like, is there any kind of spinning sensation with your dizziness?
Yeah, for sure. If I have my eyes open, it looks like the room is spinning. But the dizziness is like how my head feels, if that makes sense.
Okay, yeah, so that makes sense. Do you find that you're able to walk fine? I saw that when you came in, you were walking just fine. Is that normally how it is even during the spells, or?
During the spells, you're not really walking anywhere. You can't really focus on anything except for what's happening, so I'll usually try to sit down or lie down or something just to wait for the 20 seconds to pass. Besides that, I can walk normally, go about my day normally.
So you haven't noticed any issues with balance?
Not that I noticed, no.
And you mentioned that it goes on for about 20 seconds, is that right?
15 to 20 seconds, yeah.
Okay. All right. Okay, so have you noticed any issues with your ears? Any problems with hearing, for example? Okay. Any ringing in the ears?
No.
What about pain?
No pain.
Have you ever felt like a stuffy sensation or like a really congested sensation in your ear?
No. Nothing with my ear at all, I don't think.
Okay. Have you noticed any differences with your face? Like, did you notice any drooping or any numbness in your face?
No.
Any loss of sensation in the face or anywhere at all?
No.
Any weakness in the arms or in the legs?
I don't think so, no.
Any slurring of your speech that you noticed?
Mm-mm.
Any changes in your memory or anything with your brain?
Not that I've noticed, no.
What about headaches?
Sometimes, but definitely not every single time.
Okay. All right. And what about your eyes? Any changes with your eyes at all? Any double vision?
Besides, like, the room spinning, and obviously that's something that I'm seeing visually. Besides that, nothing else, I would say.
Okay. All right. Have you noticed that anything makes your spinning, your dizziness worse?
Maybe just if I'm not sitting or lying down, or if my eyes are open, that's what causes it. But
Like during the actual
during
spell?
the actual, but I can't think of anything that triggers it. That's the issue.
Okay. You said that when, like, sometimes you have to hold your head, right? And I think you mentioned that, like, sudden movements also make it worse.
Yeah, like, I don't want to do it right now, but for example, if I turn my neck quickly to one side or the other, that might cause it.
Okay, I hear you. Did you notice that any side is worse than the other, or that you haven't really noticed?
No, I don't think I've been keeping track like that.
Okay. Is it worse when, like, you get up in the morning from bed?
Yeah, if it's sudden, if it's like a sudden movement getting up, for sure.
Okay. Have you noticed any sensitivity to light?
No, I don't think so.
Any sensitivity to smell?
No, absolutely not.
What about noises?
No.
What about certain textures or sensations of the skin?
No.
Is there anything else you want to tell me about what you've been experiencing?
No, I feel like we've covered it all.
Okay. Oh, I also wanted to ask, like, if you're in a seated position and you stand up, have you noticed that might bring on the dizziness at all, or no?
Sometimes, but like a reoccurring theme is whether I stood up quickly.
Okay.
So if I were to just stand up normally, it usually doesn't happen, but say like I was in a rush or I stood up really quickly, that might cause it, but I still think my turning head left to right suddenly is probably what triggers it the most.
Right.
But
Okay.
I really don't know.
All right, well, we're gonna do all kinds of exams today, and I'll explain as we go. You're welcome to ask any questions that you might have, and we're gonna try to figure out what the cause is, okay?
Thank you.
All right, no worries. So just going to start by taking your vitals. I'm going to have you put this in your mouth under your tongue, and close your mouth, and then just hold it with this hand there. Now I'm going to take your blood pressure. You can just let your arm fall. Perfect. Alright, your temperature's just fine. It's good. I want you to raise your arm all the way up to the top like that, as far as you can go. I want you to pump your fist like this 10 times, all right? Perfect. So your blood pressure is definitely on the lower end, so 100/70, which doesn't necessarily mean you have low blood pressure. It could just mean that you're really fit and you're of really good health. But it could also play into the dizziness a little bit, so we definitely have to keep that in consideration. Okay, I'm just going to take your pulse. I'm just going to move your hair back. I'm just checking your respiration as well. Great. No issues there. Just write down my findings. How are you feeling right now? Are you okay? All right. Okay. Yeah, so I'm not concerned with any infection. You don't seem to have any signs right now. But of course, we'll continue to have a deeper look. Now we're going to do what's called a Romberg Test. I'm going to kind of check your cerebellar function, which basically means like your balance. So let's get you to stand up. Okay, just over here. And I want you to stand with your feet first shoulder apart. Okay, good. Alright, and then just checking your balance. Alright, now we're going to have your feet together. Let's check that. Okay, now I want you to close your eyes, okay? Okay, a little bit of swaying, but doesn't seem like you have any issues with balance here. Now, so now just raise your arms all the way up here, just at shoulder height. Let's hold that up. Okay. Your balance is still good. Now I'll have you resist my pressure down. Okay. Great. Perfect. You can open up your eyes again and sit back down. How are you feeling?
I'm okay right now.
No symptoms of dizziness, vertigo?
No, but I'm also trying to be very steady,
Okay. Alright, so now I'm going to be testing your ear. We'll start off with what's called a whisper test. So I want you to close your eyes. I'm going to sort of manipulate this ear so you can't hear from that one. And just repeat to me what number I whispered, okay?
55.
Okay, that was that. 72.
72.
Okay, good. Right. Now we're going to do what's called the Weber test. I'm going to strike this tuning fork and place it right over there on your forehead. And I want you to tell me if you hear it down the middle or on the right side or on the left side first, okay?
Right, middle to left.
Okay, we'll do that one more time.
Middle.
Okay. All right. Now we're going to do the Renee test. I'm going to strike the tuning fork, place it on the back here, kind of the mastoid area, and then I want you to tell me when you stop hearing the sound. And just clear hair away. Okay. And I want you to tell me when you stop hearing the sound. Then I'll bring it forward. You let me know when you start hearing the sound again and when you stop hearing it, okay? I want you to close your eyes for this portion. Let me know when you stop hearing the sound. Can you still hear it?
No, just stop.
Can you hear it?
Yes.
Let me know when you stop hearing it.
It's up.
Good. Okay. Now we're going to do the other side. Do you hear it?
Yes.
Let me know when you stop hearing it.
Now. Yes. Done.
Perfect. I'm just going to write that down. Take a look here. Do you feel any pain when I pull like this?
No.
What about when I push like that?
No.
Okay. Any pain back here?
No.
No sign of discharge coming out and no signs of infection in your outer ear, or the pinna rather. Okay, so let's take a look inside. Let me know if you feel any discomfort, okay? Okay, there's a slight amount of redness on the wall, but the tympanic membrane is intact, the cone of line is present in the right location. I see the bony membranes. No bulging of the membrane. Okay. And it's a nice translucent color as well, so it doesn't look like you've had any ear infections any time recently. Alright, I'll start also by looking at the external ear. I'll use this light to kind of guide me. Any pain?
No.
Any pain here?
No.
What about back here?
No.
Okay. Alright. Yeah, I don't see any issues in the external ear, so let's take a look inside as well. Just gonna go slightly deeper. Is this okay?
Yeah.
Nice and clean. Slightly red, again on the external ear, just a bit more vascularization, but nothing super red. I'm still able to visualize the cone of light. The tympanic membrane is intact. The bony landmarks are there as well. The tympanic membrane is translucent. Okay. Yep. Also no signs of infection here. So we can sort of rule out that an ear infection was present that might have caused this vertigo. Okay. So now I want to check your lymph nodes to again confirm that there hasn't been any infections or any active infections right now. So I'm going to start with these ones. The ones behind. Okay, over here. And the paratonsillar ones, just don't feel anything. Down here. And the submental. No. Then let's palpate the superficial lymph nodes in your neck. Just double check that. Okay. And the posterior ones. Just gonna tilt your head to the side here so I can palpate a little bit deeper. Let me know if is that painful at all. Any tenderness, just let me know, okay? And is your head okay? Like is there any symptoms? I'll be really gentle.
Not right now, no.
Okay. Just tilt it that way. On that side as well. And now I just want you to shrug your shoulders, okay? Okay, you can let them down. And also check your underarms. Just right here. Okay. Right. Other side. No, you're fine. No lymph nodes that are swollen at all. Did you feel any tenderness at all during any of that palpation? Okay. Alright, so now we're going to inspect your eyes. So let me just take a look here. Okay, please close your eyes. Okay, no swelling of the lacrimal glands. That's good. Okay, go ahead and open your eyes. Alright, so I want you to just look straight ahead for me. I'm going to check your... Actually, first I'm going to just check your cornea and your iris. No issues there. Okay, no issues there either for your cornea, iris, or lens. Now I'm going to be checking your pupillary reaction to light, so keep looking straight ahead for me. Good. Keep looking straight ahead. Great. So your direct and consensual reactions to light are perfectly intact. It's very good. Now I want to check your vision. So I'll be checking for your second nerve, the optic nerve. Do you wear glasses or contact lenses at all?
No, I actually just got LASIK like a year ago.
Okay, so you have perfect vision.
Supposedly.
All right. Okay. Just checking to make sure it's 14 inches away. Great. Now I want you to cover one eye. Doesn't matter which one. Okay. I want you to read the lowest line that you can read. So maybe you can go straight to the lowest one.
So the numbers?
Just the numbers from the left to the right.
4, 2, 6, 7, 2, 9.
Okay. Now I want you to cover the other eye and read the same line but backwards.
9, 3, 7, 8, 2, 4.
Okay, great.
I got the 3 wrong last time.
The 3 wrong, but it's still, I would still consider that 20/20 vision in both eyes. So now we're going to do the cover-uncover test. I want you to just look straight back there. Okay, actually just a little bit this way. Yeah, good. Great. So I didn't see any movement of the eye as when I uncovered it. Sometimes what happens is someone can have a lazy eye, but you don't have any of those issues. Okay. So now we're going to be doing the H test. So I'm going to be kind of testing the range of where your eyes can go and see if there's any lag or nystagmus is what we call it. Just follow the pen here, all right? And we're going to take it all the way to the end range. Good. Good. So far, no issues at all. Come to the center and kind of go up this way as well. Perfect. It's kind of like eye gymnastics, eh? But you did great. I didn't notice any nystagmus at rest. So right now, unprovoked, not having a vertigo episode right now, you don't have any nystagmus, and that's actually a really good sign. It tells me that most likely your case is not serious. That's good to hear. Yeah, for sure. I'm just gonna write down all the findings. 20/20 vision. No issues in oculomotor nerves. No nystagmus at rest. And negative without Duson's nerve test. Okay. Alright, so now we're going to be doing the trigeminal nerve test. So there's a couple of pieces here. We can do the sensation first. So this is kind of going to be dull sensation. Can I have your hand? That versus sharp sensation. Okay, so you can differentiate those two. Now we're going to do the same thing on your face. Different parts of the face, I want you to point where you feel that sensation, so just point at it wherever it may be. Let me know if you feel dull or sharp. Okay?
My eyes closed?
With your eyes closed.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Still sharp. Dull. 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 Still dull.
Perfect. So negative for sensation. I'm going to test the muscles of the trigeminal nerve. So I'd like for you to clench the jaw as hard as you can. Good. Now I want you to move the jaw towards this hand here. And then move the jaw that way. Kind of like actually move the jaw like that. You know, you can do. Yeah, I know it's a little silly, but I want you to move it towards me here and then towards me there. And then just resist pushing downwards. Good. Great. While we're there, actually, I want to test a few other muscles. This is part of the cranial nerve. 11. Okay. So 11. Accessory, yeah, 11. Okay. While we're here, I'm actually going to test a few other muscles. We're jumping over to cranial nerve 11, then we'll come back. So I want you to push up into my hands here as far as you can. 1, 2, 3, 4, 5. Great. And then slowly I want you to push into my hand here with your whole face like that. Is that okay for you?
Mm-hmm.
Okay. And then on this side, just push into that hand. I'm kind of turning your head actually. There you go. Perfect. And is that okay? Symptoms? Okay, good. Okay, so motor trigeminal intact and accessory intact. Perfect. We're gonna do a few silly expressions to test your facial nerve. So I want you to show your teeth like this. Great. I want you to puff out your cheeks now. great. You should raise your eyebrows like that, like you're questioning something. Close your eyes really, really tight. Don't let me open them. Don't let me open them. Perfect. Now, I think that's pretty much it. Yeah, you're doing great. So, facial nerve intact. Perfect. Okay. Good. That was just a blink reflex, just to see if you blinked. I want you to open up your mouth. I'm going to be checking the back of your throat, the uvula, to see if it's in the center, okay? I want you to say ah, ah. Good. One more time. Ah. Perfect. Okay, great. So that was vagus and glossopharyngeal. Now I want you to stick out your tongue, okay? And then now I want you to bring it to the side, the other side. Now I want you to kind of stick it in here, and then don't let me push you. Good. Other side. Don't let me push you. Okay, great. So that was just testing the strength of your tongue, making sure that your hypoglossal nerve is working well. All right. Please close your eyes. We're going to test your sense of smell. Actually, before we do that, can you plug, I'm going to plug one nostril for you. Can you breathe out? Good. Other side. Great. Now I want you to tell me what you smell, okay? Coffee. Good. There we go. So now I'm going to look actually at the retina of your eye, so the back of the eye. I want you to find a point in the wall and just keep staring at it, okay? And I'll just come closer to you. Okay. Can you look to the left for me? Great. Now back to the right, all the way to the right. Okay. Now can you look up? Good. Now down. Okay, back to center. And back to the left. Okay, very good. How's your eye feeling? Any symptoms come up? Like any symptoms of vertigo come up as I did that? No? Good. Alright. Okay, I want you to look to the left, to the right, back to center, and down, and up, and back to the right. Good. Great. I don't see any issues with your eyes whatsoever. They look perfectly fine to me. No signs of papilledema, which is kind of the swelling of the optic nerve, or any signs of infection. Nothing at all of concern. Alright, so now I'm going to be listening to your heart as well as your carotid arteries, and also feeling for your pulse in the carotid. Let's start with listening to the heart. So if you don't mind, I'm just going to palpate to find your second rib. Okay. Perfect. Just going to record my findings. As far as I heard, I didn't hear any issues with your heart. Your S1 and S2 sounds were perfectly clear. I didn't hear any extra sounds, any signs of murmurs or anything like that. And in your carotid arteries, I didn't hear any sign of a bruit, which could suggest atherosclerosis, nothing like that. And your pulse is also nice and strong. I'm just going to write all that down. And this one is too clear. No skipped beats. Okay, great. Okay, so now what we're going to do is the Dix-Hallpike Maneuver. It's a test to see if we can reproduce your vertigo symptoms. And if it does, then I've got a diagnosis for you. And luckily, what this test is actually a very benign, very mild case of vertigo, and I'll explain that more later. But I just want to let you know that your vertigo symptoms actually may reproduce, and if it does, it's very uncomfortable, but it will pass in about 15 to 20 seconds as usual. Okay? Is that all right with you? Okay. So I'm just going to turn your head like this, 45 degrees. And I'm actually going to assist you in falling down onto the table. Okay? So I'm going to hold it like this, and then we're going to fall. Okay.
Yeah, I feel okay right now.
Okay, good. Yeah, so I haven't noticed any nystagmus of the eyes, so it looks like this side, the left side, hasn't reproduced your symptoms. So now let's try the other side. Let's have you sit up slowly. So I just want you to keep your eyes open so that I can make sure to look into your eyes. I'm going to turn your head to the right and assist you in the fall.
Okay, I think I'm starting to feel it.
Yeah. Definitely see that the nystagmus is happening. Up and down, also rotational.
Yeah, the room is spinning a bit right now, but it's slowing down.
Okay. And now, yep, the nystagmus is starting to fade. And how are you feeling now?
I think we're back to normal.
Okay.
Yeah, that was definitely
sure.
vertigo though that I just had.
Yeah. So does it usually always feel like that?
Yeah, exactly.
Okay. All right, let me just make a quick note. Just hold your head in that position. Okay, vertical symptoms reproduced. Right side, vertical and rotational nystagmus. Okay, so now I'm going to be turning your head the other way slowly. Might feel a bit uncomfortable again. I'll just hold this position for a little while. Okay, and now I want you to turn your whole torso to the left side, all right? And I'll keep holding your head. Slowly, take your time. Good, and then I'll just rest here. There you go. How are you feeling?
Getting better. I had a little bit of nausea there too, but
Okay.
that's also subsiding.
Okay, good. And now we're going to sit up slowly. Again, I'm going to hold your head up, okay? Okay. All right. So for the rest of the day, I'd like for you to just kind of hold this position as much as you can. Please don't move your head down at all for the rest of the day, okay? You can turn it slowly from side to side, but please don't move it down. And the reason is we want to make sure that these certain ear crystals, and I'll explain this in more detail, stay in place. So my diagnosis for you is actually benign paroxysmal positional vertigo. And this is good news in a sense because it's not a serious cause of vertigo, and it can be treated just like we did just now, called the Epley Maneuver. And this hopefully even in sometimes even just one try of this maneuver can actually fix the vertigo. And but if it does come back, we can always try it again a few more times, once or twice, and see if that takes away your vertigo altogether. And so I want to explain to you kind of what we did just now. So here is your ear. This is a model of your ear. The outer ear, the middle ear, and the inner ear. So in the inner ear, we have both the section that deals with your auditory function, your hearing, and then you also have what is the vestibular part. So that's the one that works with balance and also sensing motion. So the semicircular canals are the ones that I want to point out right now, and they're the ones, these are 3 canals, and I'll use this to kind of demonstrate how it looks like. So you have one that is kind of a horizontal one, a little bit like this in your ear. Then you have one that's kind of anterior like that, and then a posterior one. In your case, because I did the Dix-Hallpike test and it turned out positive, you had your vertigo symptoms reproduced, and you had nystagmus, which is this kind of jerking of the eye, involuntary jerking of the eye. That means that you have the posterior canal, the one that's sort of like this, that's the one that seems to be affected, which is causing the vertigo. So I'm going to just flip the page. As you can see, these are your semicircular canals, 3 diagrams of them. And the posterior one right here, the one right in the back, that one has to do with sensing sort of the direction of movement, and what we call it angular acceleration, but basically the way that your head is moving. So this one is kind of more sensing sort of a 45-degree angle like this, if that makes any sense. So the anterior one will sort of sense kind of motion like this, and the one that's horizontal will be more rotational motion, and the posterior one's more this way, but slightly at a 45-degree angle, which explains the reason why when you're in that position where you're kind of like this, that's when your vertigo gets triggered. And for you, it's specifically on the right side. What's happening is there are some calcium crystals in what's called your utricle that is connected to these canals in your inner ear. And for some reason, whether it's head trauma or ear infection, which neither are your case, and by another reason which we don't really know, these calcium crystals actually become loose, and they will travel into the canals and start to disrupt the function of the canals. You have little hair cells in the canal that will sense the motion of your head, but with these ear crystals kind of wreaking havoc in the canals, your brain starts getting confused, and it can't really understand or interpret what is going on in your external environment based on the signals that you're receiving in the ear. Does that make sense?
Yeah, it's pretty wild.
Yeah. So the maneuver that we just did called Epley Maneuver, what we're trying to do is we're trying to bring the crystals back into its original location, the utricle, so that you don't experience the vertigo and your semicircular canals can continue to sense accelerated motion in the right way. And so you won't see the spinning around in your external environment. Do you have any questions about that?
No, honestly, I really just hope that it helped.
I hope so too. We'll just keep an eye on it for the next 24 hours. Like I said, try your best not to move your head very much, especially not in downward motion. And if you do find that the vertigo comes back, let's try it another time or another time more, and hopefully that clears it up.
Okay. All right. Thank you so much for your time today.
You're so welcome. Thank you so much for taking part in all of those maneuvers and tests, and I really hope that things get better for you.
Thank you.
Okay, take care. Bye.